Okay, guys. So just give us a quick thumbs up with respect to whether the audio part is fine, and then we can get going with today. And we'll just go through the formalities once again. And this is a live session. This would not be a recorded one. And we call this Murphy's Law. When you prepare for best, and then on event, there are events that are going to happen that are going to be beyond your control. The same thing happens in our exams also. No? When we go for exams, sometimes the computer may not log in immediately, or we may get logged out of the system. So this is like I would say practice drill where we learn to handle all kind of eventualities. Hi sir, good to see you smiling.
Good evening, sir. Good evening, sir. Hello, my dear friends. This is Dr. Azam here, your faculty of anatomy here at PrepLadder, and me and Dr. Marwah, sir, the legendary faculty of medicine. Here we have come here to help you out in the last few days of your FMG exam preparation, whoever is preparing for January 2024. And my dear friends, I think थोड़ा सा बहुत stress तो होगा इस time पर. Yes, of course. थोड़ा सा stress बहुत अच्छी बात है, but over stress don't do that one. And at the same time, I'd like to tell you that confidence बहुत अच्छी बात है, लेकिन overconfidence don't do that at this point of time. Okay. So believe me, my सर भी आपको बताएंगे manifestation के बारे में. So this works a lot. So you should have always a positive thinking and positive manifestation that yes, you are going to clear the exam. Think about the day on which you are going to get the result of this exam. And on the result day, when you are going to see your result live on the screen there, so just think of that feeling and automatically you will get that motivation to study and you are going to surely clear your exam, guys. And the good thing about FMG exam is that it requires only 50% of your performance. And because out of 300 marks, you have to just get like 150. It's not like 200 or 250. So my dear friends, remember, I believe in my students that whatever hard work that you have put in for the last few months here, you're surely going to perform, yes, 50% surely in the exam. So just be calm and composed and you will be surely able to clear this exam here, sir. Yes, of course. So I think, sir, what do you say about this one, sir?
Absolutely, absolutely. Like there are a lot of comments on that. "Nahi pada, ye nahi pada." So we are gonna guide you regarding what are the steps to be taken, what are the areas of key focus. We'll give you a timetable, how many days to be allocated for every subject. We'll also be letting you know the high yield topics as well, the ones that need to be focused and the ones which the examiners are interested in. And let bygones be bygones. कल तो जो होना था हो गया और परसों क्या होगा उसका पता नहीं. But today से पढ़ो तो सही ना, right? And there's nothing like enough for anatomy. What is enough for anatomy is you have to read the whole Grey's Anatomy. Which edition is going on, sir?
The 42nd edition is going on right now, sir.
Oh my God. Oh my God. 42nd edition. Look at the amount of hard work and dedication those guys would have done to come to the 42nd edition. So, it's not possible to read whole of Grey's Anatomy, but yeah, there has to be some tips, some tricks, which sir will be sharing with you, some higher topics, which I think would help you analyze and get the questions better. And जो सबसे important चीज़ है मेरे हिसाब से that would be that in paper 100 marks लेकर आने. तो वो अब 100 marks आपके कैसे आएंगे, that is what we are gonna focus on. We'll focus on those high yield subjects. And obviously, you know the standard data, right? I don't need to tell you that medicine is important or surgery is important or OBGY is important. But what we are gonna explain to you today is like what are those topics which need to be focused on, how many days of anatomy would be considered as sufficient. So let's move on to that slide. The first thing is obviously, that you have to forget about jo pehle ho gaya. You have to focus on abhi kya karna hai. Next 60 days is our target. And second is like, obviously you need to keep focus. So let's focus on like, what are the core aspects which need to be taken care of. We'll talk about all these aspects in a couple of minutes from now. And I move on to the slide where I let sir talk about paper one. And I'm putting a red flag here because a lot of people say ki paper one was relatively easy, but then they could not score, 75 marks, right? So paper one, I think getting 100 marks is the target that we want to achieve. And there are some topics which are like core that we'll focus on. So I think these 5 subjects which are currently on the slide are the ones which you should be putting your maximum energy into. Obviously, all subjects are important and we do not suggest any subject to be neglected. But sir, your bites regarding how should somebody be doing anatomy and biochemistry subsequently?
Sir, first thing I would like to tell all the students that when it comes to the first paper, paper one, what is the feedback that I've got from all the students in the previous exam is that the paper will be actually like, very much doable in the paper one. Why? Because you'll be actually having straightforward questions over there. When it comes to anatomy and biochemistry, I can tell you that, many of the students have sent me the messages that, yes, sir, in fact, that was like time saving मतलब वहां पर हमारा टाइम सेव हो जाता है और वही टाइम हम जो है ना मतलब क्लिनिकल क्वेश्चंस करने के लिए यूज कर सकते हैं. Up now, when it comes to anatomy and biochemistry, like from anatomy, almost there were like 19 questions last time, and from biochemistry, there are like 20 questions, sir. तो जैसे सर ने आपको बताया अभी 100 मार्क्स आपको टारगेट करने हैं फ्रॉम पेपर वन. तो इजीली आई एम टेलिंग यू, अगर हम कुछ मिस्टेक्स भी करते हैं तो समवेयर अराउंड लाइक 35 मार्क्स यू कैन इजीली स्कोर जस्ट फ्रॉम दीज टू सब्जेक्ट्स ओवर हियर. Later on, we'll also discuss about the pharma, patho, and all the other subjects also. But when it comes to anatomy, my dear friends, if you're noting down there, if you're writing there along with me, please make a note like quickly there. Yes, 1 mark for sure, always from the joints topic. So don't miss that. Look at all the examples in the joints topic and go to the exam. Number two, 1 mark for sure from the pelvis and perineum topic. Yes, nowadays the trending topic in pelvis perineum is about the extravasation of urine. They're asking a clinical question. So you should be ready for the straddle injury and the pelvic fracture cases in that one. Bulbar urethra injury and all those things. Then after that, once you are done with these two small topics there, moving on to the neuroanatomy and head and neck part. Neuro and head and neck is actually very vast, my dear friends. But what you can do is that you can actually divide them into certain categories. Number one, when it comes to neuroanatomy, one question will be for sure from the brainstem topic. Brainstem से definitely हमेशा एक सवाल आता है, and in correlation with that, I think sir will also agree, medicine में भी वहाँ पर से एक सवाल आता है, brainstem syndromes का एक question, definitely वहाँ से एक पक्का definitely आता है सर, correlating with the anatomy and medicine part. इसके अलावा जो questions आते हैं आपको, that is actually from the न्यूरो वाला पार्ट. कभी कभी क्वेश्चन आता है सिंपल सा फ्रॉम द स्पाइनल कॉर्ड. स्पाइनल कॉर्ड में दो ही पॉइंट्स इंपॉर्टेंट है, एक होता है एक्सटेंट ऑफ द स्पाइनल कॉर्ड एंड अबाउट द एंडिंग पार्ट ऑफ द स्पाइनल कॉर्ड. At the ending point, you'll be learning about that, lumbar puncture and all those things. Then moving on, the next thing is about the head and neck topics. In head and neck topic, of course, cranial nerves are important, and they're asking a lot of times the questions from the fifth cranial nerve and the seventh cranial nerve, the fifth and seventh cranial nerve. They're asking many times the questions from there, the trigeminal nerve and the facial nerve. And then, of course, whenever whenever you are learning about the cranial nerves, learn that rule of 17 करके जो होता है, जहाँ पर हम पढ़ते हैं deviation. Cranial nerve number 5, 7, then 10, and and even the 12th nerve. Whenever you are learning about that, learn with the rule of 17 करके, वो important होता है. Then transverse section of the neck, image based question आता है, that is also very much important. Then apart from that,
इनको एक क्वेश्चन डाल दो सर बीच में, सॉरी फॉर इंटरप्ट, एक क्वेश्चन डाल देता हूं, इनको बीच में कमेंटिंग करेंगे.
muscles of mastication. So these are the important, very higher topics that you have to concentrate in the head and neck part here. And when it comes to thorax part, a root of the lung, and second thing is about the positioning of the heart is very much important. They'll be always asking you that simple thing, base, apex of the heart. And then most importantly, try to correlate that with the recently they have given about the points of auscultation वाला दिया गया था. इससे पहले आपको एक चेस्ट एक्सरे दिया गया था जहां पर राइट कार्डियक शैडो पूछा गया था. And then similarly transverse section. So in thorax, what I am observing from many years is that they are giving always about the sections, transverse sections, and from there the questions are being asked. So please take care about that one. And when it comes to abdomen topic, no doubt about that, anterior abdominal wall, all the topics related to that one, deep inguinal ring, superficial inguinal ring, inguinal canal. Apart from that, like the rectus sheath, and then of course the inguinal hernia. How can you forget that one? Hernia से हमेशा सवाल आता है, तो please learn that one. And then after that, if you want to learn something in the abdomen topic, then you can actually learn about the blood vessels actually, all that celiac trunk, abdominal aorta, branches, उसके सारे आप पढ़ सकते हो. तो यहाँ से ये topics बहुत important है. So I think that is just to summarize. How can you forget the embryology part? Embryology say, please my dear friends, mark my words, one question from the development of arterial system जो हमने पढ़ा था, that is about the development of arch of aorta, pulmonary artery, ductus arteriosus, arterial system का development बहुत important है. Yes, 1 mark you can always expect from the CNS embryology. CNS embryology, they'll be giving you the neural tube defects. Anencephaly, spina bifida, rachis, वो neural tube defects बहुत important है. And then of course, apart from that, there'll be certain questions coming from the embryology of like renal embryology, development of urinary bladder, urethra, and sometimes. So these are all like very higher topics, my dear friends. Please don't forget about that. And development of the face, learn about the cleft lip, cleft lip. They're giving image-based questions based on that one. So by this, I think in this particular time, I have summarized you the very higher topics. So expecting the questions to be asked from here, sir. Yes, sir. In the paper one,
मैं
sir,
तो
like patho and pharma, I think that like many of the questions are coming from those subjects also, sir.
absolutely, sir. You did a great job by
So you're
describing it
not audible?
sometime. Okay.
Yes, my dear friends, if I'm audible, let me even tell you about the biochemistry part also. If you people are writing over there, I don't know whether you're writing there. Please give me a thumbs up if you are writing there along with me. In biochemistry, yes, my dear friends, please remember that most of the students will be like overconfident about the vitamins topic. I'm requesting all of you when you're going to the examination hall, right in the morning time when you're going to the examination hall, please revise vitamins topic. Last time, last time in the last session, there were like exactly like 5 questions only from the vitamins topic. Just imagine, my dear friends, 5 questions. Many of the students will be actually stuck between 140 and 150. We are seeing like so many students. मतलब इतना मतलब गलत लगता है ना at the time of result that day when I'll be speaking to many of the students when they'll be telling like between 140 and 150 मुझे बहुत बुरा लगता है उस दिन मतलब वो दिन एक्चुअली बहुत बुरा जाता है कि उनको समझाते हुए उनके पेरेंट्स से बात करते हुए एंड ऑल तो इसीलिए मैं कह रहा हूँ यार ये थोड़े से टॉपिक्स है जो आपके स्कोरिंग टॉपिक्स है एग्जाम को जाते वक्त प्लीज रिवाइज द vitamins टॉपिक 5 मार्क वहां से आते हैं and after the vitamins topic another important topic is enzymes topic 1 mark from there for sure they'll be asking about the inhibition competitive and non-competitive inhibition please take care about that one then after that, my dear friends, nucleotide metabolism. It's a small topic. One question will be coming from the nucleotide metabolism also. So please take care about that one. Recently, they have given the case of Lesch-Nyhan syndrome, HGPRT. Lesch-Nyhan syndrome, HGPRT. And most of the time, they'll be giving about hyperuricemia also, uric acid, the end product of purine metabolism, purine degradation. Then the treatment of that one, allopurinol, xanthine oxidase, अगर आपको याद होगा तो. And after that, my dear friends, next topic very much important in the biochemistry part. Of course, in the proteins topic, amino acid. Amino acid में यार 4 diseases होते हैं ना, like phenylketonuria, alkaptonuria, and then
Absolutely, sir. They are frequently asked.
and then one more will be the Hartnum's disease. इन चारों disease में से एक सवाल पक्का आता है. Like for sure, one question always from here. Fine. Then apart from that, in the amino acid topic, what I've observed is, hello, my dear friends, listen to me very carefully. One thing what I've observed is about the ammonia, the transport of ammonia, transamination. In which form the ammonia will be transported? Yes, from the skeletal muscle, from the all the peripheral tissues of the body, and from the brain. They are asking every time one question for sure from the transamination. So please make a note of that. Please see to that you just watch that and go before going to the exam there. Fine. And then apart from that, yes, of course, I hope you all know very well when you learn about the carbohydrate, protein, and lipid metabolism, there are like 3, 4 categories to be concentrated about all the pathways. Location of the pathway, rate limiting enzyme of the pathways, and yes, of course, the diseases associated with that one. हमेशा एक सवाल आता है glycogen storage disease में से. And then one question from the galactose and fructose metabolism for sure. Galactose and fructose metabolism for sure, my dear friends. One question will be from there. Last time also they have asked about galactosemia. And then after that, yes, lipid storage diseases. वहां से आता है जो हम पढ़ते हैं ना, Tay-Sachs disease, Gaucher's disease, and all those things. One question from there. So that is about to summarize in the biochemistry part, sir. I think I told you all the high yield topics that has to be done in biochemistry. So from here on, I think sir will actually help us with the pharma, patho, and the microvala part. Yes, sir.
Yeah. Chalo guys, quickly comment in the chat box which enzyme is deficient in Krabbe's disease. दो पूछ रहा हूँ, एक क्राबेस डिजीज और एक अलेक्जेंडर डिजीज, दोनों में आपने मेंशन करना है. थोड़ा सा मैंने एक टिपिकल दे दिया और एक थोड़ा एटिपिकल सा दिया, so I hope that you guys would be able to answer that quickly to me. And meanwhile, like I asked a very simple question, which cranial nerve would be having the longest intracranial route. So a couple of guys were spot on that and were able to answer that correctly. That would be the trochlear nerve. So that's great. And for Krabbe's disease, yep, I think I'm getting a bit of okay data somewhere. Some typos are there. Yep, I think Shadab Khan was the first one to mention it. Second, I put up Alexander and Canavan also. So if you can comment regarding Alexander disease and Canavan, that would be great. Otherwise, it's okay. I mean, our job is to tell you that sometimes unpredictable questions can be coming. Now, coming to pathology, guys, I think that it's very, very scoring, especially the journal path and the systemic pathology part. And the systemic pathology part has to be studied in correlation with general medicine. So whenever you're studying like 2 subjects in a day, my suggestion to you would be that try to cover a system of medicine and pathology on the same sitting also, because it doesn't make sense, right, that you're going to read about heart failure cells in pathology and then you're going to read about the cardiovascular system from the medicine component. So maybe like, maybe in medicine, a bit of aspects of murmur would be there extra, maybe aspects related to infective endocarditis would be a little extra. But then I think if you are going to study it in an integrated fashion, you would be able to do great. And as far as pharmacology is concerned, what I want to say is that a lot of people start from autonomic nervous system, and it is really, really a very vast topic. To energy khatam ho jata hai. So by the time like people are able to, go to the other topics like drugs acting on CNS, drugs acting on central nervous system, cardiovascular system, tab tak energy khatam hota hai. Like, so people tend to neglect those topics and they are the ones which are usually the ones which are asked. So, I mean, it's not that autonomic nervous system is not important, but then I think you can relegate it to the back. And by this time, I think if you put your hand on your heart, you would be knowing that in pharmacology, there would be some subtopics which are always weak of people. So people are not able to remember those drugs, or they're not able to remember mechanism of action. So like I put up anti-diabetic drugs. Okay, let's have an interaction here. Please comment in the chat box which anti-diabetic drugs increase cardiovascular mortality. Waiting for your answers, guys. Which anti-diabetic drug will cause worsening of cardiovascular mortality? Because we're talking about pharmacology, right? And diabetes is a topic that you guys are very good with. So I thought that, okay, let me put up a question before you. And while you are answering, I just want to bring to your attention that all of these drugs know on a single page of paper, you should practice this mechanism of action. I'm not saying drug of choice. They don't ask one-liners in pharmacology like drug of choice. It always be a case given to you. तो वो केस को आपने वर्कआउट करना. वो केस में वो आपसे स्पेसिफिकली सिनेरियो बना देगा, कहानी सुनाएगा पूरी, फिर बोलेगा कि जी इसके लिए आप बताओ कि सबसे अप्रोप्रिएट ट्रीटमेंट क्या होगा. सो आई एक्सपेक्ट दैट यू गाइस शुड बी एबल टू पिक अप दैट केस एंड बी एबल टू आंसर द क्वेश्चन ऑन अ अप्रोप्रिएट बेसिस. तो खासकर फ्रॉम फार्मा एंड पैथोलॉजी आई वुड से ये दोनों ही मेडिसिन से लिंक्ड सब्जेक्ट्स. I mean, when you're reading treatment of a particular disease, right, you will be able to answer that very well. Yes, I think a lot of people gave good answers there. Worsening of cardiovascular mortality would be with pioglitazone and rosiglitazone, and improvement is seen with semaglutide and empagliflozin. So the newer anti-diabetic drugs are the ones which they love to ask. And then PSM, right? I think that national health programs everybody studies, but they're not able to answer in the exam because they get into the nitty and gritty, very very specific details of it. Centrally sponsored scheme, or whether it's going to be a state-sponsored scheme, and then the individual targets of those programs are asked. So it's not only the name of the program. So I would say, I personally, if I was you, I would be investing at least half a day to reading about national health programs. But these 5 subjects that we have discussed at this moment, they would constitute something like approximately 15 days of your preparation. So we are going to discuss a timetable before you very soon. I'm going to show you the timetable. But before I show you the timetable, we were trying to focus on like, where do you need to channel channelize your energy initially, and once you're able to focus your energy on these particular subjects, then remaining subjects will automatically fall into place. Because आप लोग इतने capable हो यार कि देखो साइकेट्री आप आधे दिन में कर लोगे, एनेस्थीसिया आप आधे दिन में कर लोगे, मे बी ऑर्थोपेडिक्स कर लोगे, लेकिन बाकी सब्जेक्ट्स में तो टाइम लग जाएगा ना। तो सर मैं आपसे पूछना चाहूंगा, फॉर स्पेसिफिकली फॉर अनाटमी, हाउ मेनी डेज शुड वन बी इन्वेस्टिंग इनटू अनाटमी? बाकी कुछ सब्जेक्ट्स तो मैंने मेंशन किए हैं सर, बट इफ यू कैन गिव अ फीडबैक रिगार्डिंग how many like days should be invested into anatomy, biochemistry and physiology as well, from the first prof perspective, sir.
Yes, sir, absolutely. I think, sir, like whatever number of days which are left out right now, investing a time of like 3 days in anatomy will be perfect at this point of time, because approximately we are left out with 60 days from here onwards. I'm just omitting like few days here and there, because you will be missing out 1 or 2 days here and there. So approximately if you take like 60 days, out of that, 3 days you can keep for anatomy, and you can divide it in such a way that on one day you can take a big topic like a neuroanatomy along with a small topic. Then second day you can take head and neck, a big topic along with a small topic. And third day you can take embryology as a big topic, and then along with some other small topic. So in that way you can actually divide the entire anatomy into this one here. And biochemistry requires hardly like 2 days of a revision. That will be more than enough for revising the entire biochemistry in 2 days. So that will be easier for the students to do it, the entire biochemistry. On day one, they can actually do the metabolisms, carbohydrate, protein, and lipid metabolism together, so that they can also get an integrated approach of that one. And on the day two, they can do the DNA and RNA, the entire part, replication, transcription, translation, and the entire genetics well apart, along with some miscellaneous topics like enzymes, vitamins, and all, so that it will be like balanced approach for 2 days of biochemistry is more than enough. And physiology also, sir, approximately like 3 days. 3 days are good enough to go with it, with the physiology also. I think that is the best time that you can give for this one.
True. Sir, how many questions would you suggest to be doing in anatomy? Minimum कितने होने चाहिए सर? नंबर ऑफ क्वेश्चंस इन एनाटॉमी। गाइस आपके लिए मैसेज यहाँ पर ये है कि आपने क्या करना है, आपने अभी से माइक्रो प्लानिंग करनी है कि आपने कितने डेज नोट्स पढ़ने हैं, कितने देर एमसीक्यू करने हैं। क्योंकि देखो 3 दिन का टाइम है, तो 3 दिन में आप 12-14 घंटे पढ़ लोगे, 15 घंटे पढ़ लोगे, तो 15 घंटे भी पढ़ोगे तो 45 घंटे ही हुए ना यार। 45 घंटे में जान थोड़ी निकाल लेंगे यार। 45 घंटे में आदमी को नोट्स भी करने हैं और एमसीक्यूज भी करने हैं। सो सर, any suggestion with respect to how many MCQs of anatomy should be a person should be doing?
Sir, approximately like 50 high-yield MCQs, I should say. And saying that, I want to tell all the students that अभी तक तो आपने जब प्रिपरेशन किया है, ऑब्वियसली आपने MCQs तो सॉल्व किए होंगे। जब कभी आपने एनाटॉमी रेगुलर क्लास की है तो MCQ सॉल्व किए होंगे। तो अक्सर हम कहते हैं स्टूडेंट्स को क्लासेस में कि जब भी आप MCQ सॉल्व करते हो तो मार्क करके रखिएगा जो MCQs में आपने गलती की है। तो आई वुड सजेस्ट दैट इन दिस 3 days of revision, please try to see those MCQs during our regular classes where you have made mistakes. तो आज जो आपने बुक मार्क करके रखे होंगे, तो वो MCQs यहाँ पर ये 3 दिन में देखना बहुत इंपॉर्टेंट है। दैट इज इंपॉर्टेंट थिंग सर। सो अप्रोक्सीमेटली या
नहीं, बिल्कुल सही सर, आपने बिल्कुल बोला कि सारे एमसीक्यूज करने का मतलब नहीं है, लेकिन जो एमसीक्यूज गलत हुए थे पहले उनको करना है। सो बेसिकली यहाँ पे हम नंबर देने की जगह पे लाइक हम बोले कि 500 कर लो, अब हो नहीं पाएंगे तो अननेसेसरी प्रेशर क्रिएट हो जाएगा, है ना। तो इंस्टेड ऑफ सेइंग एक एमसीक्यू नंबर, जो सर ने बोला बड़ा पर्टिनेंट पॉइंट है कि भाई आप जो क्वेश्चंस कर रहे हो तो उसमें लाइक फोकस कर लो, लाइक ट्राई टू डू हाई यील्ड वाले। भाई एफएमजी वाले कर लो, अभी नीट पीजी वाले कहाँ से हो जाएंगे, राइट। नीट पीजी वाले क्वेश्चंस जो होते हैं वो डिफिकल्ट होते हैं, तो वो पहले करने होते हैं। अभी नीट पीजी के एमसीक्यू नहीं करने हैं। अभी जो आपका कस्टम मॉड्यूल, जब आप प्रेपलैडर के आप में जाओगे तो जब आप कस्टम मॉड्यूल बनाओगे तो कस्टम मॉड्यूल में जो टैग सिलेक्ट करना है वो एफएमजी वाला टैग सिलेक्ट करना है, और उसके बेसिक पुराने वाले क्वेश्चन कर लो, ताकि हम फाइटिंग फिट हो जाए कि हमें ये पता हो कि यार एक्चुअली पढ़ना क्या है, राइट। अब नीट पीजी वाले में तो रेयर चीज पूछेगा ना, मान लो वो आपसे पूछा मल्टीपल एंडोक्राइन न्यूप्लेसिया टाइप 4। अब हम 1 और 2 पे तो एनर्जी लगाते हैं, 3 तक आते आते एनर्जी डाउन होती है। 4 वाले में वो पूछे टेस्टिकुलर ट्यूमर कौन से वाला होगा, तो दिक्कत हो जाएगी ना यार। तो पॉइंट इज कि आप टैग्स में नीट को डाल दो, वंस इन अ वाइल नेगेटिव मार्किंग आएगी तो आप यू टेंड टू फील अ लिटिल डिप्रेस्ड कि यार मन खराब हो गया, आज तो नंबर नहीं आए, तो वैसे ही पढ़ने का मन नहीं करता। तो पहले आप जो सिंपल वाले सवाल है ना, कॉमन सेंस वाले, उनको कर लो। हर क्वेश्चन जो एग्जाम में होगा वो वन लाइनर नहीं होता, सारे क्लिनिकल वाले होते हैं, 2-3। देखो एवरी सब्जेक्ट इज क्लिनिकल सब्जेक्ट, ऐसा थोड़ी ना कि एनाटॉमी क्लिनिकल नहीं है और बायोकेमिस्ट्री क्लिनिकल नहीं है, वो तो फंडामेंटल्स और क्लिनिकल है ना। तो आपने सारे सब्जेक्ट्स करने हैं। और यहाँ पे मेरा सजेशन, दो सर ने बोला जो गलत हुए, मेरा सजेशन है कम से कम अगर आप 100, 150, 200 एमसीक्यू भी का टारगेट बनाते हो ना, अगर मैं ये कह रहा हूँ अगर इस चेक शीट के ऊपर आपके 3+ लग गए, दैट इज डेज एलोकेटेड आपने करे हैं, आपने नोट्स भी कर लिए, एमसीक्यू भी कर लिए, और आप अगर कोई एक्स्ट्रा चीज भी यूज कर रहे हो, तो एक्स्ट्रा चीज मान लो ऐप होगी, बुक होगी, जो भी XYZ, अगर आपने यहाँ पे आपके प्लस, मैं तो कहता हूँ नंबर और डेज छोड़ दो, सिर्फ आपने हर सब्जेक्ट के आगे इसमें ऐसे अगर प्लस लगा दिया तो ये आपका सब्जेक्ट खत्म हो गया। तो अगर आपने एक बारी अनाटॉमी में ये 3 चीजें करी है, नोट्स करे हैं, एमसीक्यू, कुछ भी एमसीक्यू, आपको खुद टारगेट बनाना है कि मैं कितने कर सकता हूँ, क्योंकि आपको अपनी करने की स्पीड मालूम है। अब बिल्कुल ही नहीं करे हुए यार, तो फिर तो देखो इट्स अ अपहिल राइड, मतलब मैं हाउ कैन आई से कि यार गाड़ी जो है वो अपहिल स्लाइड पे चढ़ानी है और वो सीधा 4th गियर में चढ़ा दे, वो तो नहीं होती ना। इट इज लाइक 1st गियर, 2nd गियर, 3rd गियर में गाड़ी डलती है। बट इफ यू पुट योर हार्ट एंड सोल इनटू स्टडीइंग इन द प्रीवियस 6 मंथ्स, चाहे आप फेस टू फेस कर रहे हो, चाहे आप रूटीन ऑनलाइन ऐप से क्लासेस कर रहे हो, तो ट्राई टू लाइक डू एज मच एज पॉसिबल। अनरियलिस्टिक टारगेट मत बनाना। लेकिन अगर इसमें आपने इस चेकशीट में आपने 19 into 3 57+ लगा दिए ना, तो मैं अश्योर कर रहा हूँ कि आप एग्जाम निकाल लोगे। लेकिन इसमें अगर प्लस नहीं लगे हुए हैं, तो आप ये समझ लेना कि ये वाली जो चेकशीट है, ये मतलब फिर तो टाइम वेस्टेज वाली बात हो रही है। कि मान लो मैंने कहीं पे नोट्स करे, कहीं पे मैंने सिर्फ एमसीक्यू, मैं एग्जांपल दे रहा हूँ। आप कहते हो सर मैंने तो फिजियो पढ़ी नहीं, मैं सिर्फ एमसीक्यू करके चले जाओ, तो लास्ट में तो और क्या करोगे, फिर एमसीक्यू करके जाओगे। तो अगर आपका यहाँ पे एक ही प्लस लगा, तो यार वो जस्टिफाइड प्रिपरेशन तो नहीं हुआ, बट एटलीस्ट समथिंग इज बेटर देन डूइंग नथिंग ना। तो पॉइंट इज कि जितनी बार यहाँ पे प्लस 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 आ जाते हैं, उतना आपका कैपेसिटी इंक्रीज हो जाती है। एंड देन अ क्वेश्चन केम अप, शुड वी डू ऑल क्वेश्चंस ऑफ क्यू बैंक? यस एब्सोल्युटली मैन, लेकिन अभी तो टाइम नहीं है ना, तो आपने जुडिशियसली करना है कि जो सबने टॉपिक्स बताए एटलीस्ट उनको तो करोगे।
एग्जैक्टली एग्जैक्टली
चाहे वो एनाटॉमी के हैं, चाहे वो बायोकेमिस्ट्री के हैं, आप उनको तो करोगे ना। कि भाई जो प्रोटीन मेटाबॉलिज्म का आपने टैग लगा के सर्च किया, तो मेटाबॉलिज्म के क्वेश्चन तो करोगे उस तरीके से, है ना। वैसे ही कार्ब मेटाबॉलिज्म वाले भी करेंगे। अलेक्जेंडर और कैनावर डिजीज का आंसर क्या आया, है ना। क्रावेज के बाद में सबने ब्रेक लगा दी, है ना। फैब्रीज और फार्बर डिजीज में गलतियां हो जाती, है ना। फैब्रीज एंड फार्बर डिजीज में गलतियां होती हैं। कमेंट करना जरा चैट बॉक्स में फटाफट से, बिना गूगल किए, फैब्रीज डिजीज और फार्बर्स डिजीज के एंजाइम मेंशन करना जरा, है ना। एंड मीनवाइल विल कंटिन्यू विद द चिट चैट।
यस
तो
एग्जैक्टली
बेसिक
एग्जैक्टली
यार मैसेज सिर्फ यही है कि लाइक ट्राई टू डू एज मेनी प्लसेस इन दिस शीट। और हमने ये जो टाइम टेबल बनाया है तकरीबन 45 दिन का है। इसका पीडीएफ आपको चाहिए होगा तो आप मेल डाल देना, ड्रॉप कर देना marwamedicine@gmail.com पे, या हम इस वाले यूट्यूब के लिंक के डिस्क्रिप्शन में भी एक लिंक प्रोवाइड कर देंगे, जिसमें आप इसको डाउनलोड कर सकते हो। और इसमें आप इसका प्रिंट लगा के लगा लेना कहीं पे भी। और उसके बाद में इसको जितना भर लोगे, उतना आप, आई थिंक यू विल बी इन अ मच मोर पॉजिटिव फ्रेम ऑफ माइंड। क्योंकि व्हेन यू विल सी दिस योरसेल्फ ना, तो यू विल फील मोर कॉन्फिडेंट मैन, लाइक ओके मैन, दिस मच ऑफ द चंक इज डन, दिस मच ऑफ दिस इज लेफ्ट। बाकी अननेसेसरी स्ट्रेस मेरे हिसाब से नहीं करना है सर। फॉर स्ट्रेस वुड यू लाइक टू एडवाइज एनीथिंग?
Sir, actually, like I think the students are understanding why sir is actually stressing a lot about solving MCQs here. Why? Because whatever notes you are studying right now, final exam आपका जो है ना university prop exam नहीं है. It's not like prop exam where you have to write down the long answer, short answer, and all. Why sir is stressing a lot on the MCQs is that because after reading the notes, when you see a question with 4 options, your mind will work in a different manner. And you have to train your brain for that final day. Because on the final day, the exam paper is going to be like multiple choice question where you have like one question and 4 options. So please uske liye train kariye. That's the reason why. That's the reason why the sir is actually stretching a lot on solving MCQs here. MCQ solve करना है. और एक और पॉइंट मैं यहाँ पर ऐड करूंगा सर कि जब आप एमसीक्यू सॉल्व करोगे, जो आपने गलती की है वो तो सॉल्व करिएगा, बट उसके साथ साथ में इंपॉर्टेंट एक पॉइंट याद रखिएगा, इट्स नॉट ओनली अबाउट सॉल्विंग प्रीवियस ईयर क्वेश्चंस, इट्स ऑल अबाउट सॉल्विंग द प्रीवियस ईयर टॉपिक्स एक्चुअली। सर मैंने बहुत सारे स्टूडेंट्स को देखा है कि वो क्या करते हैं ना, एक दिन में 50 क्वेश्चन सॉल्व करते हैं शाम को, और फिर 50 क्वेश्चन में सॉल्व करने में जस्ट वो क्वेश्चन देख लिया, ऑप्शन देख लिया, क्वेश्चन देख लिया और ऑप्शन देख लिया, और समझते हैं कि मतलब सारे चीजें हमने कर लिए। क्वेश्चन सॉल्व करने का मतलब ये होता है कि यू हैव टू एक्चुअली sort out like what is wrong with the remaining 3 options, why they are wrong. It's not about just seeing the question and the answer, you have to see why the three. Like analysis is very much important. तो यही तो मैं हमेशा आपको कहता हूँ कि whenever you are doing your grand test or subject wise test, grand test and subject wise test, or even the question bank here, please my dear friends remember that some students, what is going to happen at the time when they are solving the grand test, if they get some good marks grand test mein, like somewhere around 250 and all, they're like very happy. If they're getting like less marks, they're very sad. So it is not the time of getting very happy or being very sad. At this time, it should be like, अगर आपको 250 भी आ रहे हैं, if you're even getting 250 in the grand test, you should be worried about what happened with the 50. The preparation actually begins after the grand test, not the grand test, the preparation. Grand test आपका preparation नहीं होता है, preparation start होता है grand test के बाद, जब आप उसको analyze करोगे. आप उसको एनालाइज करोगे, ठीक है. सो प्लीज एनालाइज योर ग्रैंड टेस्ट वेरी वेल. आफ्टर दैट वट एवर रॉन्ग क्वेश्चन दैट यू हैव डन, यू हैव टू सॉर्ट आउट कि आपने वो टॉपिक पढ़ा था कि नहीं पढ़ा था. अगर पढ़ा था तो ग्रैंड टेस्ट में ड्यूरिंग द एग्जाम व्हाई आर यू नॉट एबल टू रिवाइज दैट वन, व्हाई आर यू नॉट एबल टू रिकॉल दैट वन. या फिर हैव यू डन सर्टेन सिली मिस्टेक्स, ओवर रीडिंग हो रहा है क्या, इंग्लिश में इशू हो रहा है क्या. तो यू हैव टू एक्चुअली एनालाइज योरसेल्फ इन दैट वन. सो दैट इज वेरी वेरी मच इंपॉर्टेंट माय डियर फ्रेंड्स. दैट इज द रीजन व्हाई वी आर स्ट्रेसिंग अ लॉट on solving the MCQs here, especially solving the previous year topics, not just the previous year questions, guys. Okay. And yes, sir, when it comes to like, managing the stress at this point of time, I would like to tell all of you people that please avoid all those things that you have been doing. Like I have seen many of the students, मतलब just chill करने के लिए, थोड़ा सा काम करने के लिए अपने कान में यहाँ पर ना वो एयरपॉड्स लगाकर लाउड म्यूजिक सुनते हैं. That is not the way how you calm down yourself. Okay, when it is not the way how you relieve your stress, it's in fact going to affect you a lot. So please don't listen to that loud music and all those things. Yes, instead of that, I think the best way, like go for certain prayers that you can do, or calm yourself with the prayers and all those things. Relax yourself in that manner. Otherwise those other things are not going to help you कि यार ये वीडियो देख लिया, वो वीडियो देख लिया, ये गाना देख लिया, गाना सुन लिया. That is not going to help you. That is most important thing. And apart from that, yes, of course, if you just once you are done with your effective revision, in the meanwhile you can just go through the images wala part. That will be like a little bit easier part, especially in the radiology. Hardly there'll be like number of images will be there. If you just go through those images and all, that will actually relax your mind, and then it will also give you the motivation that you're studying that one also. Sir, I think you can add more onto this one here.
नहीं देखो, सर ने रेडियोलॉजी की बात करी तो वो तो सीधा एक्सरे देगा, बोलेगा फिफ्थ रिब है कि फोर्थ रिब है ना, एंटीरियर है कि पोस्टीरियर है, तो वहां पे कंफ्यूजन हो जाता है. तो आई थिंक द एनालिसिस एनालिटिकल कैपेबिलिटी बहुत मैटर करती है. चेक आउट द एक्सरेज एंड वी विल बी डूइंग कपल ऑफ मोर लाइव सेशंस एंड वी आर डूइंग LRR ऑन द ऐप आल्सो. तो आई थिंक यू शुड बी like religiously watching all those sessions. They'll give you the insight into how to attempt questions. Because in LRR, we are not only just doing ratification, right? We are not saying that this is investigational choice and this is a drug of choice. We are trying to teach you how to effectively rule out the questions, because you guys are brilliant people. You rule out two options, but between the two confusion रहता है ना. So हमारा कोशिश यही है कि भाई we are able to guide you into that mode कि आप automatic mode पे जा रहे हो, आप AI के जैसे परफॉर्म कर रहे हो कि फटाफट फटाफट AI में कुछ भी क्वेरी डालो फटाफट से आंसर करती है ना. तो मैं चाहता हूँ कि हमारे जो फ्यूचर डॉक्टर्स हैं वो एआई को बीट करें, एआई से ज्यादा अक्लमंद हो, एआई से ज्यादा फास्टर हो. बिकॉज अल्टीमेटली तो यार पेशेंट क्या करेगा, वो एआई चैट जीपीटी, वो बोलेगा चैट जीपीटी का 4.0 का मेरा सब्सक्रिप्शन है और मैं तो ना उसमें ही अपने डिजीज के सिम्टम डाल देता हूँ, चैट जीपीटी ने मेरे को डायग्नोसिस बता दिया. तो भाई फिर तो हमारा काम ही खत्म हो जाएगा ना. तो वी हैव टू बी अ स्टेप अबव दैट, राइट? We have to have that analytical capability that we read a question and our eyes are like, okay man, this is the final differential and इन चार differential में से फिर final वाले को workout करना है. तो I think with practice it comes into being. But cutting the long story short, अगर मेरे हिसाब से आप इसको पहले तो देखो एनालाइज करना है कि प्रॉब्लम है. अगर आप खुद पेपर लेके बैठोगे ना तो ब्लैंक हो जाओगे, बिकॉज व्हेन आई आस्क पीपल टू मेक अ टाइम टेबल बनता नहीं है लोगों से. तो हमने एक बेसिक रफ वैल्यू आपको दी है, 45 डेज का प्लान है कि यार 45 डेज में इतने इतने दिन पढ़ना है अपने सब्जेक्ट्स को. अब इसमें कई लोगों के लिए क्या होगा कि सपोज आप बोलते हो कि सर मेडिसिन 4 दिन में कैसे हो जाएगी, तो यार करना है ना. पीपल आर एबल टू डू दैट. आई मीन पीपल आर sacrificing their sleep. People are like getting into that groove and are able to do it. So I understand you will be able to study like 14 hours 15 hours a day maximum. वो बहुत ज्यादा बोल रहा हूँ, 15 भी जरूरी नहीं है. Even if you're able to study effectively for 12 hours. लोग क्या करते हैं कि ध्यान से नहीं पढ़ते. You have to read the data with care so that the data gets imprinted into your brain. You need to have that photographic memory वाला concept, जिसकी वजह से I think you are able to get the information in your brain. And मैंने यहाँ रेड फ्लैग्स बनाए, लाइक ये जो कलर कोडिंग है रैंडम नहीं है. मैंने ग्रीन फ्लैग्स बनाए हैं, रेड फ्लैग्स बनाए हैं. जो ग्रीन फ्लैग्स हैं वो देखो वो हर कोई करता है. पैथो एवरीबडी इज गुड एट, फोरेंसिक मेडिसिन तो सब कर लेते हैं, साइकेट्री रेडियोलॉजी सब कर लेते हैं, है ना. थोड़ा बहुत ऊपर नीचे हो जाएगा, रिप वाला क्वेश्चन गलत हो जाएगा. ही विल आस्क यू राइट मिडल जोन निमोनिया वर्सेस राइट लोअर जोन निमोनिया. So in a lateral view on an X-ray, you might be confused regarding right middle zone versus right lower zone pneumonia. So I mean, I understand that, but the point is there are some green flags which you are gonna be able to handle, but the red flags are the ones which everybody says, "Oh, मैं कर लूँगा," but वो होता नहीं. So what we want you to do is like make these subjects which are like weak to be average, और जो strong है उनको strong रहने दो. स्ट्रॉन्ग को सुपर स्ट्रॉन्ग मत बनाओ. लाइक व्हाट पीपल डू इज कि अगर फोरेंसिक मेडिसिन है, फोरेंसिक मेडिसिन 3 दिन पढ़ रहे हैं तो मतलब नहीं ना यार. आई मीन फोरेंसिक मेडिसिन अगर एक दिन में खत्म हो जाए तो उसको निपटा के खत्म करो ना. साइकेट्री हाफ डे में हो जाए तो उसको खत्म करो. एंड साइकेट्री अगेन इट्स नॉट अबाउट शिजोफ्रेनिया मैन, इट्स नॉट अबाउट शिजोफ्रेनिया. दे गो मच मोर बियॉन्ड दैट. So read about mood disorders, read about GAD, how to differentiate GAD from panic disorder, right? So it's not about drug of choice that they're going to ask you. They'll give you a case, and it's a proper case that has to be analyzed with your mind. And you are guys who have to just devote time for this. And now is the time when it is make or break. It is the time when you have to really study, when you have to focus uh, with concentration, and would be able to get out with subsequently, I mean, decent scores. Sir, you wanted to say something in between?
No, sir. Fine. Absolutely fine, sir. Go ahead, sir.
Okay. Guys, we spoke regarding between in between. Sir mentioned regarding hernias also in surgery. Like they've asked extensively about tissue flaps, right? So they'll give you like a case of a person having a decubitus ulcer, and then they'll tell you what tissue flap or I mean what kind of a flap-based surgery should be done in that patient so that effective healing of a decubitus ulcer can be made. So I mean traditionally we tend to neglect that information. In surgery, everybody reads esophagus, stomach, khatam, right? By the time you come into the small intestine, large intestine, and later on the energy is finished. So try going retrograde in this particular time. Try to start from anal canal and rectum and go vice versa. And I think the same would apply for anatomy also, that we tend to do upper limb, lower limb, and उससे यार एक दो क्वेश्चन है वो तो वैसे ही कर लोगे, right? But those ones where he's gonna ask you surface marking of superficial inguinal ring and ask you surface marking of deep inguinal ring, because कल को यार future में when you are a doctor, right, if you are doing recruitment of somebody into a government job, you have to check that guy is having hernia or not. No, so you should know the surface marking of superficial. Where you keep your finger, the examiner will know. Now in this is not a practical exam, तो आपको anatomy वाला वो aspect सीखना पड़ेगा ना कि भाई pubic tubercle से कितना medial जाना है, कितना lateral जाना है, all those things that sir would be teaching you. So surface markings of all these aspects have to be done. Similarly in surgery, I was saying read about hernias very well, and don't read only about like inguinal hernias. Read about femoral hernias as well. Read about the management protocols for each one of them. And like most of the time what I've seen is they are going to give you questions which look very simple. Everybody knows difference between omphalocele and gastroschisis. वो सर्जरी पूछ ले. इफ यू गो थ्रू द पीवैक्यू, वो बोला गैस्ट्रोसाइसिस का केस आया हुआ है भाई, क्या करोगे, है ना. तो उसमें सिलो बैग लगाते हैं, वो सिलो बैग को धीरे धीरे रिटेन करते हैं. और वो धीरे धीरे क्यों लगाते हैं? बिकॉज अगर आप सडनली सारे कंटेंट्स को वापस डाल दोगे abdomen में तो abdominal कंपार्टमेंट सिंड्रोम हो जाएगा. सो इट्स अ सिलो बैग पुट ओवर द कंटेंट्स टू प्रिवेंट कॉन्टैक्ट विद एनवायरनमेंट, देन अ ग्रेजुअल रिडक्शन ऑफ द सेम कैन बी डन. आई एम जस्ट टू सी योर इंटरेक्शन. मुझे कमेंट करना कौन सा न्यूरल ट्यूब डिफेक्ट होता है वेयर सर्जिकल रिपेयर इज पॉसिबल. Please comment in the chat box, guys. Which neural tube defect are you aware of where surgical repair is possible? Because otherwise तो सारे neural tube defects में तो person की death ही हो जाती है. तो कौन सा question was which neural tube defect is surgical repair possible and longevity in the patient would be present? Yes, guys, waiting for your answer. Which neural tube defect surgical repair is possible and there would be chances of survival in the patient, because most of the time like the chances of survival are almost very minimal, bleak chances. Most patients would die. Spina bifida is of two varieties, spina bifida occulta and spina occulta वाला पेशेंट आता ही नहीं है. स्पाइना बाइफिडा ऑकल्टा वाला मरीज तो आता ही नहीं है. स्पाइना बाइफिडा ऑकल्टा तो एक्सरे पे पता चलता है. Answer is not spina bifida occulta, guys. I think subsequently I've had an answer. Somebody mentioned that very correctly. Danish was the first one to mention there. I think if I picked it up correctly, the neurotube defect which is amenable to surgical repair is meningocele, because meningocele is only meninges covering, so surgical repair can be done and they can survive up to adult age group. So the question was like surgical repair possible and survival capability, because baki मालूम है तो सब में there is gonna be a bad prognosis present. So obviously, like, you have read neurative defects, but then it is ability to come out with quick answers that would be of paramount importance. So write down all those medical conditions, and you should be knowing regarding the surgery of choice for each of them. You should be knowing the indications for surgery for each one of them. And like, I think that the red flags that I put here before you, the 2 red flags for paper 1 and 3 red flags for paper 3, paper number 2. If somebody is able to master these 5, then I think the scores would go in range of 180 to 200. If you're not able to master it, फर्क नहीं पड़ता, still like 170s 160s you'll be able to do, but like they are the difference between 130s and 170s, honestly speaking. बाकी सारे सब कर ले पैथो, everybody does very well. No, madam teaches so well that everybody is good at pathology, and you can also see shade of green is also changing. So, patho stronger people, psychiatry stronger people, but then micro, अरे सर वो माइकोलॉजी नहीं आता है, या पैरासिटोलॉजी नहीं आता है, या ऑप्थोमोलॉजी के रेटिना नहीं पढ़ा हुआ है. So like, you can see the shades of green there. So what we have discussed is this sheet is made after discussing with students who have told me कि sir, the people who cleared the exam, उनका honest feedback है कि maybe they did not clear it the first time, they cleared it the second time. So I said put your hand on your heart and tell me कि भाई कौन से तेरे सब्जेक्ट वीक थे, कौन से तेरे गुड थे, और कौन से तेरे थे कि थोड़ा थोड़ा आता है. Like people say कि pharma पढ़ा है, but then pharma is like when they ask you mechanism of action of drugs, people are not able to answer that, right? I'll put up another question. Tell me the antidote for apixaban toxicity. Antidote for apixaban toxicity. Yes, guys, quick comments in the chat meanwhile. And sir, you can provide some bits. Like I've been talking for a bit for a while, so you can
No,
give
sir.
your points, sir.
Perfect.
People would love to hear you, sir, after this. And my question is, what is the antidote for apixaban toxicity? Yes, guys. Sir, you can continue.
Yes, yes, sir. Yes, sir. It's going perfectly right, sir. Like you have given the right advices over here. One of the student was asking over there, like about the LRR. Yes, of course, my dear friends. I'm going to come up with the LRR session very soon. It is scheduled on 16th of November. 16th of November, it is actually scheduled LRR for FMGE students. And yes, of course, that will be much sufficient for your exams. Sufficient in the sense, of course, the word revision itself says that it is like revision. So you have to always have a vision before doing the revision. So we are going to discuss all the high yield topics. And yes, as sir told here, we are going to tell you how to deal with the questions, how to omit the options in that one, and the very high yield topics, मतलब जो पढ़कर जाना ही चाहिए आपको. ऐसे नहीं कि ये मत बोलो कि मतलब जो है ना, अगर LRR पढ़ेंगे तो बस यही पढ़ लेंगे तो हो जाएगा, क्या ऐसा नहीं है. बट एट द सेम टाइम दोज आर द वेरी हाई थिंग, मतलब वो पढ़कर ही जाना है आपको. यू हैव टू स्टडी दोज थिंग्स एंड गो. And yes, of course, recently I've also done with the rapid revision session on PrepLadder. I hope you all have gone through that one also. And yes, that is also going to help you all. So we are going to do LRR for especially for the FMG students. And yes, that will be surely beneficial for you, sir. हाँ, yes, of course, YouTube पर भी हम करेंगे सेशन, जैसे सर बता रहे थे. Like we are going to do certain sessions on this one also. So don't worry about that. We'll be helping you out that on the YouTube also, guys. Yes, sir. How many GTs are sufficient, sir? What do you say, sir?
I think more than 3 to 4, उसमें भी 4 दिन लग जाएंगे, because you see, if you're giving 3, then you have to analyze the GT also and analyze your mistakes also. And when you do that to 3 to 4 days, we are talking about 60 days here. So out of 60 days, 45 days to your query is taking place. Then 15 days is a bit of MCQs and high yield volatile subjects. So since we are short on time, we are limited on time, we have made a ready-made schedule for you for study program for 45 days, giving you another buffer of 15 days for practicing multiple choice questions. And we would like you to do MCQs on the same day of completing a particular subset only. Like, for example, sir said do nucleic acid protein metabolism, carb metabolism, then try to do the questions of the same topic and just get the goddamn monkey off your back. वो load mind में पड़ा रहता है यार, question नहीं करे. So try to do मेरे हिसाब से a sufficient number of questions and you would be doing just great. सबसे पहले जो प्रोटोकॉल है वो ये है कि पहले रैपिड रिवीजन से करो. रैपिड रिवीजन से जब I am assuming that you have gone through the main videos, right?
Main
So
videos.
once you've gone through the main videos, now you go through the rapid revision part and you use LRR as a prop. LLR will help you ultimately analyze those questions, because when sir will tell you how to rule out those options, then you will see na ki yaar, this is the way and this is the way to be followed. So you need to think like that in the actual exam also. So yep, I think that is of paramount importance.
Yes, sir. Yes, sir. Absolutely fine, sir. So, yes, we are going to do the rapid revision also, guys. Don't worry about that. I'm going to help you. So, on 16th, we'll be doing the LRR. Yes, I'll be doing. Will you conduct the LRR of anatomy and biochemistry on the YouTube? I'll be doing the LRR of anatomy, and for yes, biochemistry, we have a wonderful faculty with us, Dr. Shanmuga Priya ma'am, and she will be doing the LRR for biochemistry, guys.
Great, great, great.
A mail has been sent to you regarding doubt on OSA.
I'll do
What
that,
is your
sir.
take on that one?
I'll reply to that, sir, immediately after this, doc. Don't worry, Ravi. I'll be answering you very soon once the session is over. Sir, any last words for
Yes,
towards
guys.
the end discussion, sir?
Yes, guys. So, like, this is the entire timetable that we have prepared, keeping in mind the 60 days, and out of that, 45 days we have prepared for this one. And please follow, as sir said here, the PDF will be given to you, and you can just put the plus marks there and be confident. At last, my dear friends, I would like to say that few things which most of the students always, every faculty will be telling you, but still you'll be making certain mistakes. Apart from the academics that we have discussed extensively over here, but certain general things are also important before going to the exam. If any of the student is getting like your center in some other city, please take care about that one. Last moment travel and all those things, please take care about that one. Okay, so try to go to the other city if you are getting your center in the other cities. So beforehand you try to go there, like at least like 3 days or 4 days before, because you get acclimatized to those conditions over there. Obviously, like December and January being like winter season here, and at the same time, what will happen once you move to some other cities, the food habits and all those will be changing. So please try to acclimatize going there. And apart from that, last week of preparation is very much important. Please keep all those high yield images, and especially the memorizing tables and all those things for the last moment, my dear friends. The last week you have to revise them. And that is what I would like to tell you, people. And yes, of course, please be confident. You will be surely able to clear the exam. It's not a very difficult exam. It's all about doing it strategically. और जैसे मैं हमेशा कहता हूँ, keep one thing in mind to gain the confidence, to gain yourself some confidence. Keep one thing in mind. For FMG exam, it's not about knowing everything about one subject. It's all about knowing something about every subject. सो डोंट बी वरीड इन योर माइंड कि यार इसमें भी खत्म ही नहीं हुआ है, ये खत्म ही नहीं हुआ है, वो खत्म नहीं हुआ है. सम फ्रेंड्स विल बी कमिंग एंड सडनली टेलिंग यू, अरे यार ये वो पॉइंट याद है क्या. तो डोंट वरी अबाउट दैट वन. इट्स ऑल अबाउट नोइंग सर्टेन हायर टॉपिक्स of all these subjects. It's not about learning everything of one subject. It's all about learning something from every subject. I think saying that we can close this here, sir. Sir, any final words for the students?
Absolutely, guys. Sir has said that beautifully. Put up realistic study targets. Try to do as much as you can. Don't talk about things like this is difficult, this is easy. Doctors के लिए कुछ भी difficult नहीं होता है, right? You guys are smart people. You will be able to push through yourself and get over to the other side, as I can say. ये सिर्फ एक temporary सा वो है, एक phase where I saw that momentum of people was becoming lesser and people were like getting distracted by so many things. So we thought that we'll conduct a session together and hope that we'll be able to motivate you, pump you, so that you are able to get back into your rhythm, because this is the time, after once the exam is released, adrenaline date comes out, adrenaline is released, then that adrenaline causes fatigue and then everybody is like down, right? Abhi yaar padhai nahi ho rahi, abhi kam pad rahe hain. So abhi, like what we were seeing also was that most of the time the study duration is going around 5-6 hours, maybe 7-8 hours, which is not sufficient. So you have to pump it up, amp it up, increase the number of hours that you study, increase the concentration with which you study, increase the number of minutes in 1 hour. 1 घंटा पढ़ते हो तो 1 घंटा ध्यान से पढ़ना है. ऐसा नहीं कि 30 मिनट पढ़ रहे हैं और 30 मिनट कहीं दिमाग हो रहा है, ऐसा नहीं है. And don't try to talk to people who are talking negative. Talk to people who say positive. Not that they are saying, oh yeah, we everything is super cool. No one like that. Confident stuff, right? I mean, it's about getting facts right. It is about medical science is all about analytical capabilities कि भाई shortest possible time में आप अपने targets को achieve कर पाओ. So with this guys, thank you so much for joining in into this live session. And initially there were a couple of hiccups with the sound part, which as I said, Murphy's law. Things when things go wrong, I mean they can just go wrong. Don't worry, this happens with everybody. We have got used to it. हमने कर लिया तुम भी कर लोगे, right? So it's just that you are those budding doctors who are gonna be able to perform subsequently. Initially everybody has a self doubt कि भाई सही कर रहा हूँ डॉक्टर बन के, है ना? क्या मैं डॉक्टर बन सकता हूँ? क्या मेरी शक्ल लगती है डॉक्टर जैसी? घर वाले तो बोलते हैं ना क्या बच्चा सा है, क्या बच्ची सी है, अरे तुम क्या डॉक्टर लगते हो, right? So it's not about how you look, it is about the aptitude that you have, it is about the hard work that you can push in. So great guys, try to give at least 3 GTs. That is my suggestion. ज्यादा भी देने का मतलब नहीं बनता है, पर 3 से 4 GT देना. नंबर मत देखना कितने आए, है ना? कई GT में नंबर कम आएंगे, कईयों में ज्यादा आएंगे तो सिलेक्ट सिटी वॉक में जाके पार्टी मत करना. और अगर कम आए तो रोना नहीं कि भाई आज कम आ गए, मुझे तो कुछ नहीं आता, क्योंकि एग्जाम में भी ऐसे ही होता है. जब तुम एग्जाम में बैठोगे ना फर्स्ट आवर में, तो तुम्हें यही लगेगा यार ये क्या हो गया, बाउंसर, ऐसे ऐसे क्वेश्चन. वो तुम्हारा रिदम अपसेट करेगा. वो तुम्हारे को तुम्हारी मेंटल स्ट्रेंथ चेक कर रहा है कि क्या ये लड़का घबरा जाता है, क्या ये बच्चा जो है, ये मतलब फ्यूचर डॉक्टर जो है, क्या ये नर्वस हो जाता है. तो कुछ क्वेश्चन ऐसे देगा बाउंसर तुम्हारे को, ये तुम्हें करेगा अरे यार ये क्या हो गया. तो यू जस्ट नीड टू कीप पेशेंस एंड लाइक जैसे क्रिकेट मैच होता है, क्रिकेट मैच में भी तो फास्ट बॉलर पहले क्या करता है, बाउंसर मारता है ना? फिर उसके बाद में थोड़ी देर बाद थक जाता है बाउंसर मार मार के, फिर उसको मारो छक्का सीधा. So same thing here, right? So it is about persistence and analytical capabilities. So thank you so much, guys. We are logging out of the system, and God bless you. And we'll be seeing you in our LRR sessions subsequently, where you can join, and we'll have a nice, healthy, high level, cerebral level participation.
Absolutely. So thank you guys. All the best. God bless you all.
Okay, sir. Okay, sir. Bye bye, sir.
Bye bye.